What's going on? Dr. Nash here with Complete Connection Chiropractic. Today we've got Ryan with us. We've been working with Ryan for a few weeks now. Ryan is a business owner and a business owner in construction work. So Ryan was coming into us with a lot of stress and compression in his low back and his hips. And a lot of it was affecting how he's standing at work, and a lot of that was building up into pain and discomfort in his feet, kind of affecting a lot of his fatigue throughout the day and really just impacting the rest of his day to be able to relax when he gets home. So for us, these last few weeks, we've seen awesome improvement, not just with his feet, but overall quality of life. And a lot of this is stemmed from not just work we're doing here, but things that he's doing at home. And Ryan's been a freaking blast to work with. So today we're gonna walk through what a typical day looks like with Ryan, and we're gonna get Ryan adjusted here. So Ryan, we're gonna have you start by laying face down for me. So as we're working with Ryan, the goal is to create better ease into his system and not just doing something because it's a cookie cutter approach. We need to do exactly what Ryan needs. Today we're gonna be focusing more on his right side. So for this, we're working on extension, and primarily at a job site when Ryan's picking up equipment, he's picking up supplies, Ryan's doing it from a flexed forward position. So we're working on getting him better extension into his spine and helping him even breathe better and get better energy flowing and helping with that fatigue in this area. So Ryan, we're gonna be building up, my friend. Good, good. Beautiful, very clean, precise, right at the level of T9 for him. So the tendency for Ryan is he builds this up here and it's bringing everything back, and we're helping this sit forward and helping his extension in his mid back, which is awesome. Okay, next what we're gonna do, Ryan, is you're gonna flip over and lay on your back for us. One of the most important pieces of what Ryan does is he's gotta be able to think clearly. And when it comes to mental fog and fatigue, a lot of that is coming from his brain's ability to communicate with the rest of his body. So when we're clearing out everything, it's clearing out his brain's capacity to think and process information in a way that is helping him heal and feel and get better. Good. Awesome. Okay. So what we're gonna start with is C5, which for Ryan is a really important piece in allowing the head to flex and extend. And like we were talking about before, a lot of his work is done flexed forward, not just with his mid-back, but his head. So by creating better extension here, it's creating more peace and ease into the upper part of his back. So we're gonna right up top here, my friend. Good, good, and let your head be nice and heavy for me. Good, fantastic. We're just gonna be up. Beautiful. Nicely done, Ryan. And we're gonna work on this last piece right up here, the atlas. The most important part of the spine is the area where your brain is going out through your neck. When we clear out pressure there, this clears out communication between everything between your head and your toes. Awesome. Starting right up top here, Ryan. Good, let your head be heavy again for me. Beautiful. Right up top. Fantastic. Clean, precise, and specific. Right, at C1. Now with Ryan, especially with what he's doing at work, he's on his feet all day long. And most people appreciate I work on their feet after adjusting their neck, so we're gonna get Ryan's feet adjusted as well. As we move down, this is a big component to helping his feet not just build up stress here or build up stress in his hips, is allowing his feet to transfer energy appropriately. And when it comes to the energy transfer throughout the foot when you're walking around, it starts with the heels and goes through the balls of your feet. So I'm gonna start with the heels first. And a lot of this can feel like Achilles tension, can even come up as even knee pain. A lot of times, improper foot function leads to knee pain, and that can go right up the kinetic chain called Valix phenomenon, up into hip pain and more. So we're gonna start here with Ryan's left heel. And he's gonna be nice and loose for us. We're just gonna start right here, nice and quick. Beautiful. Nicely done, Ryan. The other component to his foot is the talus. The talus is the main part of the foot that allows you to flex and extend. What we're gonna do is we're gonna add some decompression, because lots of times this can even pop up as shin splints. So we're gonna be right here. Beautiful. Good. And then he's got a row of 3 bones that make up the arch of his foot. And much like an arch, if he builds up stress in one part of the arch, that can actually create a scenario where the bone's shifting and it's not allowing the arch to actually have the support it needs. Good. Beautiful. 1 and 2. We're going to repeat the same thing with his right feet because he's on both feet all day long. Good. Beautiful. Good. Right. Nice and loose. Beautiful. Good. Last bit. Good. Fantastic. Okay. And we're going to sit on up, my friend. You're going to swing your legs this way for me. Okay. So this is a big part of what we're doing here at Complete Connection. We're not just applying a cookie cutter approach because Ryan's specific needs are specific to him. And his work that he's doing at his job, make sure that we're not just doing things here, we're also doing things at home. So part of our routine is built around maintaining progress in between appointments. So we've got a nice regimen right now of just a couple minutes a day, things that are specifically working on the areas that we just adjusted and maintaining progress in between appointments. So with our construction workers like Ryan, it's more than just the work that we're doing here. And with anybody that comes into Complete Connection Chiropractic, we're trying to form a tailored plan around things that we're working on consistently. A lot like if you're brushing your teeth only the days you have dentist appointments, we're not gonna have a pretty good dental hygiene. So what we're gonna be working on is things that we can add into a daily routine, a couple minutes a day, that we can really stack progress, and days on top of days, we can always see momentum going up and up. So there's 2 things I'd really be focusing with somebody like Ryan. His emphasis is gonna be more on extension and rotation. The first thing we're going to be doing is extension. So with extension for Ryan, we figured out that his mid-back is where he carries most of his stress. And again, that comes from carrying materials. Most of his jobs at the job site require him to be flexed or doing any sort of work where he's in a position where he's putting stress right between and right beneath his shoulder blades. So that's where we need to focus on getting him some support. We're going to be starting what we call Cobra. So for Cobra, we're going to be laying on our stomach. And you want to make sure your spine's neutral and your hands are almost like in a push-up position right underneath your shoulders. So we're going to start with our head. And my nose is pretty much touching. I'm going to do a subtle chin tuck, and then I'm peeling my head back. And as I come up, I'm also coming up onto my elbows. And I'm going up and I'm looking up at the same time. With Ryan, we're having him hold here for 5 seconds, and then peeling back down. And then restarting the process for 5 reps. The emphasis with the neck, especially looking up at the end, is really allowing us to have the capacity to get better extension at the transition between his neck and his back. Again, a very common place where a lot of people nowadays are carrying stress, whether from working on computers or being on cell phones. The second part to our routine with Ryan is focusing on rotation. So what we need to do is have a wall. And we're going to have our knee that's closest to the wall, that's going to be on the floor, and my shoulders are just touching the wall. And we're going to have both hands up in front of us like this. The wall is going to provide us with a little bit of support because we're focusing on rotation. So we're going to rotate away from the wall and look towards our backhand. The wall's keeping this side honest. And we're here, we're having Ryan take 5 deep breaths. Because this rotation with the breath, it's adding an element of like decompression, and again, it's acting kind of like a pump for his spine. So the more his ribs move, the more fluid and oiled up his spine will be. And we're adding this in before and after work, and we're doing both sides. This is what a typical adjustment looks like here with Ryan. We've made awesome progress these last few weeks, and the cool thing is, this is something we're addressing the root cause. So we're not just slapping a Band-Aid on it, hoping he feels better today and comes back again next week. This is something that's addressing this cause now, because as a business owner, there's nothing more frustrating than having an issue and not understanding where the root cause is. So if you're somebody like Ryan that's dealing with, maybe it's back pain, maybe it's hip, maybe it's shoulders, maybe it's even foot pain that's leading into hip pain, give us a call at Complete Connection Chiropractic, 515-412-4784. You can also check us out at our website at connectionchiro.com or at Complete Connection on Instagram.